and I think we have some great things to talk about. I'll start by discussing the Federal Reserve. As you know, it just happened minutes ago, but to me it makes me very happy. And I want to congratulate the Federal Reserve. For starters, they've lowered the Fed rate from what it was, which was 1 to 1.25, and it's been lowered down to 0 to 0.25, 4.25. So it's 0 to 0.25. That's a big difference. It's quite a bit, about a point. And in addition, very importantly, the Federal Reserve is going to be purchasing $500 billion of treasuries and $200 billion of mortgage-backed securities, and that number can increase. But they're going to start with that, and that's really good news. It's really great for our country. It's something that we're very happy. I have to say this. I'm very happy. And they did it in one step. They didn't do it in 4 steps over a long period of time. They did it in one step, and I think that people in the market should be very thrilled, and that brings us, we're the strongest country in the world by far, financially and every other way, and that brings us in line with what other countries are. They actually have negative rates, but look, we got it down to potentially 0, so that's a big step, and I'm very happy they did it. And you will not hear anything bad about me unless it's about a month or 2 from now. So I congratulate the Federal Reserve. I think it's terrific. Just came out just as we spoke. I wasn't going to mention Federal Reserve or anything else, but this came out as we were walking up. I want to thank the people at Google and Google Communications because, as you know, they substantiated what I said on Friday. The head of Google, who's a great gentleman, called us and he apologized. I don't know where the press got their fake news, but they got it someplace. But as you know, this is from Google. They put out a release, and you guys can figure it out yourselves and how that got out, and I'm sure you'll apologize. But it would be great if we could really give the news correctly. It would be so wonderful. I just had a phone call with very impressive people, the biggest in the world of stores and groceries and all, and I'll give you the names. Dave Clark, Whole Foods; Mark Clouse, CEO of Campbell Soup Company; Brian Cornell, CEO of Target; Randy Eddiker, Chairman and CEO, President of Hy-Vee; Jeff Hammering, CEO of General Mills, great company; Kevin Huracan, President and CEO of Cisco; Craig Jelinek, CEO of Costco; Todd Jones, CEO of Publix Supermarkets; Donnie King, Tyson Foods; David McLennan, Chairman and CEO of Cargill; Rodney McMullen, CEO, Chairman of Kroger, big company; Doug McMillan, CEO of Walmart. He's been fantastic. Doug was here, as you know, on Friday, and he watched the market go up 2,000 points. On Friday, it went up 2,000, almost 2,000 points. Todd Vaso, CEO of Dollar General Corporation, and Vivek Sankaran, President and CEO of Albertsons. So these are all phenomenal companies. These are great companies. We had a long conversation with them, and they're going to work 24 hours round the clock, keeping their stores stocked. I would like to say that people shouldn't go out and buy. We're going to all be great. We're going to be so good. We're going to do what's happened with the Fed is phenomenal news. What's happening with all of these incredible companies is phenomenal news. But you don't have to buy so much. Take it easy. Just relax. People are going in and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass. The folks that we spoke to, they've done a fantastic job. They're going to meet the needs of the public. They're going round the clock if they have to, and they're committed to the communities where they're serving and which they serve so beautifully and have for a long time. And they're buying a lot of additional things to sell. But again, they actually have asked me to say, could you buy a little bit less, please? I thought I'd never hear that from a retailer. All of them are working hand in hand with the federal government as well as the state and local leaders to ensure food and essentials are constantly available, and they'll do it. There's no shortages. We have no shortages other than people are buying anywhere from 3 to 5 times what they would normally buy. It's going to be there for a long time. We're doing numbers, and there's a pent-up demand that's incredible. When this passes, when this goes through, you're going to see numbers, I predict, I guess I'm allowed to predict just like Wall Street people are allowed to predict, and they're pretty much in agreement. You're going to see there's a pent-up demand like a lot of people, including me, haven't seen before. But this has to get through. They know they're getting through the crisis and will require an all-of-America approach, and that's very important. They're committed to remaining open during this crisis, totally open. They have to stay open. Those stores have to stay open. They supply our country. Our supply chains in America are the most powerful in the world, and they're all working very hard. They're working around the clock, and the stores are stocking up at a level that's beyond Christmas time, and it's great. It was very reassuring speaking to these people. They have it totally in hand. There's no need for anybody in the country to hoard essential food supplies. They said to me, could you please tell them, just go and buy, enjoy it, have a nice dinner, relax, because there's plenty, but you don't have to buy the quantities because it's hard to refill the stores on a basis as rapid as they're refilling them. And we are using the full power of the federal government to defeat the coronavirus, and we will do whatever it takes, and we're doing, I think, really, really well. A lot of good things are going to happen. I want to thank all of the people standing behind me. You know, these are phenomenal people, and we have some of them right over here, but the people behind me have been working round the clock, and they're doing an incredible job. We see what's happening. We see what's going on in other countries. We're looking we're learning from watching other countries, frankly. There's a very contagious virus. It's incredible, but it's something that we have tremendous control of. I think very important to young people, people of good health, and groups of people just are not strongly affected. Elderly people that are not well or not well in certain respects are really a dangerous group. We have to watch them. We have to protect them very much. We have to really watch over them and protect them because they are very vulnerable. And with that, if it's okay, I'm just going to go and make some calls. I'm talking about Federal Reserve. I think it's a tremendous thing that took place just now. I didn't know I would be surprised on a Sunday. I don't know if that's ever happened on a Sunday before, but I would think there are a lot of people on Wall Street that are very happy. And I can tell you that I'm very happy. I didn't expect this, and I like being surprised. So our Vice President, who's doing an incredible job, is going to take over, and I will see you probably tomorrow. Thank you very much.
49 states across the country, I want to assure the American people that this administration, all of our partners at the state level and local health officials have no higher priority than the health and safety of the American public. And at the President's direction, we will continue not only a whole-of-government approach, but as we'll discuss today, we'll continue to build on a whole-of-America approach to confront the coronavirus across the country. The health experts continue to confirm to us that based on the latest information, for the American people as a whole, the risk of serious illness remains low. But because the risk is heavily weighted to the most vulnerable, to people with immunodeficiencies and to people who are elderly with serious underlying chronic health conditions. Our administration, and I know state administrations, will continue to focus on the most vulnerable, and we will continue to urge every American to be vigilant in practicing good hygiene, taking the advice of the CDC and local health experts to keep those most vulnerable safe. I know I speak on behalf of the President and our entire team when I say how grateful we are for governors all across the country and the seamless partnership that we have forged with them and with state health officials, with our federal team. I spoke today to Governor Pritzker of Illinois, and we are in continuous communication with governors a phone call away. They know that they can contact us and address even the smallest need. Because as a former governor, I know firsthand that when it comes to health challenges in America, our states are on the ground in the lead, our local health organizations, and we've built a great partnership. We also want to express great appreciation to the American people. Not surprisingly, it is inspiring to see the way tens of millions of Americans are responding with compassion, with common sense, and we want to express particular gratitude to communities of faith that participated in today's National Day of Prayer. We've seen places of worship implementing policies to keep those most vulnerable safe, and also we're seeing communities of faith already stepping forward to support and to encourage those most vulnerable. I heard tell of a church back in Indiana that's actually no longer having services till April 10th, but in the meantime, they'll be offering daycare to the children of healthcare workers in central Indiana. And churches all across the country are taking the opportunity to reach out and put feet on their faith, and it's truly inspiring. As the President mentioned today, he spoke today to leaders in the grocery store industry and where people buy our food, and we heard and we're reminded that America has the most efficient and effective supply chain in the world, and it's working just fine. As the President said, he received a commitment from those grocery store executives that stores will stay open throughout the days that lie ahead. We were told that hours may be reduced to allow for cleaning and to resupply, but American families can be confident your local grocery store is going to be open, it's going to be well supplied, and they specifically asked us to encourage Americans just buy your weekly needs in grocery because the grocery stores will remain open. Also, very movingly, those same executives all reiterated their commitment to continue to support local food banks in the way that our grocers continue to do around America. Tomorrow, the President and I will be briefing all the nation's governors, states and territories, and the District of Columbia. We'll be speaking about the progress that we're making, and we'll be speaking to them specifically about our widening partnership on expanding testing to the American people. So allow me to speak to that issue, and then I'm going to recognize Admiral Brett Giroir, who will describe for us the excellent work the Public Health Service is doing. Dr. Birx will describe the importance of the new national public-private partnership for diagnostic testing that is going to open the door to thousands of more tests in real time for the American people in the days ahead. First, some fundamentals. As the American people know, testing is now available in all 50 states. Either state labs are either conducting the tests themselves or the CDC is processing tests. They're using the traditional manner of a manual test that allows for 40 to 60 tests a day. It is among the reasons why the President several weeks ago tasked this group at the White House to reach out to commercial labs around the country and forge that public-private partnership that would bring the high speed, or more accurately, the high throughput testing for coronavirus available in real time. And based on the unprecedented speed of the FDA, which last week approved high throughput coronavirus testings for Roche and Thermo Fisher, we will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today to process coronavirus tests much more rapidly and a much higher volume for the American people. In terms of delivering those services, more than 10 states, in addition to CDC labs, public health labs, and labs that states can now authorize in their states, more than 10 states have implemented their own drive-through testing sites, and we want to commend New York, Colorado, Delaware, Washington State, Texas, and others that have implemented these on-site places where people can obtain tests. Most are using the current CDC testing, the manual testing, but we are working closely with our governors, as you will hear momentarily, to make sure that the new testing regimen is available for their remote sites as well. As I mentioned, as of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods. We're also working with a number of retail partners to add to the work that states are doing around the country, working to set up parking lot testing centers outside of stores, and Admiral Brett Giroir will detail the progress that we've made over the last 72 hours. Following the President's declaration of emergency, the Admiral and our Public Health Service have forged a partnership now with FEMA, made possible by that declaration, and they've reached out to all 50 states to create a process that will enable all Americans who need to be tested to go to a community-based testing site outside of usual healthcare facilities. The focus of these tests, as Dr. Birx will describe momentarily, will be on those most in need. A priority will be placed on healthcare workers and first responders who are out there coming alongside people that are being impacted by the coronavirus. We want to make sure they have access to the testing as a priority. And then Americans 65 or over with a cough or a fever or other symptoms will be prioritized over other tests that are extended. As I mentioned, Admiral Giroir will describe the progress that we've made in just a few moments, but we're going to continue to work very diligently, hour by hour, day by day in the days ahead, to expand testing around the country and access to this extraordinary and unprecedented national public-private partnership for diagnostic testing. With regard to testing, as we expand testing, we're so pleased that Congress joined with our administration to make sure that cost is never going to be a barrier to anyone getting a coronavirus test. As you recall, several weeks ago, the President directed a change in our Medicare and Medicaid programs to ensure that coronavirus testing was included. Health insurers were brought in. They all agreed to waive co-pays, but because of the good bipartisan work done in the House of Representatives, now all coronavirus testing is free, and it's free for every American, including uninsured Americans. And we continue to urge passage of the legislation that will be considered by the Senate this week. Let me say one final word about the testing issue. And that is that we, as the President often says, we're all in this together. And it's absolutely important that as we expand testing resources across the country, beginning by prioritizing the areas that CDC and our state leadership tell us are most important. It's important that the tests are available for people that are most in need and for our healthcare workers and first responders that are helping them and supporting them. As Dr. Birx will describe, the testing that is available should only be done if for any reason you think you may have the coronavirus. We encourage people to consult their doctor, and if you're symptom-free, we encourage you to work with us to make sure the testing is available for people that are experiencing symptoms. It's extremely important that we have the continuing cooperation of every American as we expand testing and make it available during this challenging time in the life of our nation. With that, I'm going to ask Dr. Birx, I'm going to ask Admiral Brett Giroir, the Public Health Service and the leader of this great commission corps behind me, to come up and describe the extraordinary work that they have done over the last 72 hours and will be doing each and every day in conjunction with our states to expand testing to community-based testing across the country for the American people using this new public-private partnership diagnostic testing.
Impacted community of New Rochelle, New York, and CBS News correspondent Meg Oliver. Meg?
Margaret, this drive-through testing site is open 12 hours a day and has been testing hundreds of patients. It's the state's effort to keep people who could be sick out of healthcare facilities where they could potentially infect more people.
Are you here to be tested?
A steady stream of residents drove up and lined up for coronavirus testing just north of New York City. 70-year-old Michael Myers told us he got tested as a precaution.
How are you feeling?
We feel fine.
He takes care of his 41-year-old son who has a spinal cord injury.
How are you coping with all of this?
Day by day, it's, every day things change.
In Kirkland, Washington's Life Care Center, the emergency has only grown. The number of positive cases jumped to 47 more employees at the center Friday night. Hospitals are racing to respond, setting up triage and evaluating how many patients they could handle if there's an onslaught of new cases.
We would get them right into the back to be treated right away without a second thought.
Coast to coast, drugstores and grocery stores are no match for consumers who rush to store shelves for supplies. Apple and Nike both announced drastic action, closing most of their stores around the globe until March 27th. Back in the containment zone in New Rochelle, Jerry De Jesus is struggling to keep his restaurant open. He's lost 25% of his customers.
People in this area want to just get back to normality. Right now, there's panic in the air.
For now, this is the new normal. The governor's office tells me they plan to open a new mobile testing site in Long Island in a few days. Their goal is to test 6,000 people a day by next week. Margaret?
From passengers from the Schengen area, which totaled more than 40,000 passengers yesterday. So to give you an idea, in one day, we processed over half of the total number of individuals we have processed medical screening since February 2nd. So that is an enormous challenge that we have placed on our officers and contract medical staff at airports, and they are stepping up. But to be clear, the lines, again, that we saw overnight at a limited number of airports, including Chicago, are unacceptable. Acting Commissioner, CBP Commissioner Morgan also believes they're unacceptable and has personally engaged leadership at all 13 funneling airports. We did make the necessary adjustments at 12 of the funneling airports. However, again, at Chicago, those adjustments were not made quick enough, but we have course corrected. We've adjusted our processes, we continue to surge personnel, and we are certainly glad to see certain airports and certain airlines step up, partner with us, and help address this unprecedented situation. As I walked in here today, so far today, at all of our funneling airports, to include Chicago, we have an average wait time of 30 minutes. So we addressed the problem, we identified the problem, addressed it, and we have fixed it. And we look forward to, again, accommodating passengers this evening as well.
You don't have to buy so much. Take it easy. Just relax. People are going in and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass. The folks that we spoke to, they've done a fantastic job. They're going to meet the needs of the public. They're going round the clock if they have to, and they're committed to the communities where they're serving and which they serve so beautifully and have for a long time. And they're buying a lot of additional things to sell. But again, they actually have asked me to say, could you buy a little bit less, please? I thought I'd never hear that from a retailer. All of them are working hand in hand with the federal government as well as the state and local leaders to ensure food and essentials are constantly available, and they'll do it. There's no shortages. We have no shortages other than people are buying anywhere from 3 to 5 times what they would normally buy. It's going to be there for a long time. Our supply chains in America are the most powerful in the world, and they're all working very hard. They're working around the clock, and the stores are stocking up at a level that's beyond Christmas time. And it's great. It was very reassuring speaking to these people. They have it totally in hand. There's no need for anybody in the country to hoard essential food supplies. They said to me, could you please tell them, just go and buy, enjoy it, have a nice dinner, relax, because there's plenty. But you don't have to buy the quantities because it's hard to refill the stores on a basis as rapid as they're refilling them. And we are using the full power of the federal government to defeat the coronavirus, and we will do whatever it takes, and we're doing, I think, really, really well.
An international dispute between Berlin and Washington amid reports that the United States was trying to persuade CureVac to move its research to the U.S. German government sources told Reuters on Sunday that the U.S. administration was looking into how it could gain access to a potential vaccine being developed by CureVac. German Interior Minister Horst Seehofer told a news conference that the government's coronavirus committee would discuss the CureVac case on Monday.
I can only say that I heard that several times today from regional members who this concerns. We will talk about this in the crisis meeting tomorrow.
Earlier, a German newspaper reported that U.S. President Donald Trump had offered funds to lure CureVac to the United States, and the German government was making counteroffers to tempt it to stay. Responding to the report, the U.S. ambassador to Germany, Richard Grenell, wrote on Twitter, "The Welt story was wrong." A U.S. official speaking on condition of anonymity said, "This story is wildly overplayed. We will continue to talk to any company that claims to be able to help, and any solution found would be shared with the world." The German newspaper quoted an unidentified German government source as saying Trump was trying to secure the scientists' work exclusively and would do anything to get a vaccine for the United States, quote, "but only for the United States." The coronavirus currently sweeping the globe has infected more than 162,000 people and claimed more than 6,000 lives.
Get it done. We need it. We want it fast.
Trump has made and tweeted encouraging comments about the outlook for a vaccine.
You're talking about 3 to 4 months in a couple of cases and a year in other cases.
But has at least once been corrected by his own experts on the timeline.
A vaccine that you make and start testing in a year is not a vaccine that's deployable. So he's asking the question, when is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
CureVac issued a statement on Sunday in which it said, quote, "The company rejects current rumors of an acquisition."